With CML started on TKI. What is the most appropriate technique for routine monitoring and treatment of the monitoring of treatment response? Anybody?
RT-qPCR.
Correct. That is good. Another question would be, can any other technique be used for monitoring of treatment response? Again, so maybe in a resource limited setting where you know that the monitoring is important, even FISH can be used to. Yes. No, flow cytometry cannot be used. FISH can be used. So this is a 38-year-old male and common complaints: fatigue, satiety, massive splenomegaly, hyperleukocytosis with thrombocytosis, myelocytic bulge. There are a lot of basophils. All the stages of maturation: myelocyte, metamyelocyte, myelocytic bulge, ME ratio raised 10:1, blaster of like less than 5%. There is basophilia. So as per the NCCN guidelines, when a patient presents to you, you have to establish the diagnosis first using a molecular technique. So this is FISH. This is a fusion probe, and you can see that this is the BCR-ABL translocation which has happened, leading to a positive signal which is yellow. Similar thing can be also found out on the karyotype 922 translocation, and also it can be found out on the RT-PCR, which is the reverse transcriptase polymerase chain reaction. That is the diagnostic. This is the gel electrophoresis. This is not the quantitative RT-PCR. So monitoring of this patient can be done using FISH. It can be done by using RT-qPCR also, RT-PCR also, using a different kind of a mechanism. Basically, it is a nested RT-PCR that can be discussed later on again. So coming on to RT-qPCR, it is a reverse transcriptase quantitative PCR, right? It is also called as qPCR. So first of all, the RNA from the sample has to be extracted. This RNA has to be converted into the cDNA or the complementary DNA using reverse transcriptase and random primers. This cDNA is again put forward into the PCR. So this PCR happens using a set of standards. Certain standards have to be identified. These standards are commercially available, and this has to be diluted, or you can get pre-dilutions from the vendor. And this basically on the left you can see that this is ABL1. So ABL1, GUS, these are all housekeeping genes. So housekeeping genes helps to identify the integrity of the RNA. So if the housekeeping gene has not amplified, means the RNA has undergone a lot of trauma. It has gone trauma because of the temperature, or the extraction quality was not right. So RNA has actually it's degraded, and this sample cannot be analyzed further, right? So, and over here you can see BCR-ABL. So there will be different primers and probe. Again, RT-qPCR can be it takes, I'll elaborate it later. So in this there will be primers for ABL1 along with a probe, which will amplify at certain CT values. Again, the absolute values of this will be used to create a standard curve against which the values of the sample will be plotted. So this red actually represents the standard, and you can see a very close knit ABL1 cluster, means all the RNA was in the same zone, or the QC metrics of the extraction has actually passed. In this you can see the BCR-ABL. So again, red ones are the standards, and the standards actually run from very low copies of say one copy to 1 million copies, and each of the blue and green spots are samples. Or so it is showing that most of the clustering is happening over here. So all the values of each and every sample should be plotted in this particular line for it to be a good analysis or good experimental setup. So again, criteria for response, and this is from NCCN. Cytogenetic response can also be used. Yes, I'm coming into that, Dr. Manjari. So cytogenetic response can be assessed using FISH. So when you are using molecular response criteria, so at 3 months time point, the BCR-ABL transcript copy should be less than 10%. So when that copy is say at 9%, you can still detect occasional fusion into the peripheral blood of this patient. So this can be used to detect the complete the minor cytogenetic response or the partial cytogenetic response. So in resource constrained settings where the patient is not going to come back again, at 3-month time point, if your cytogenetic response assessment using FISH comes out to be negative, it will give you the mental clarity. Okay, the patient is having a good response and it is less than 10%. Correct. Again, it is not a method of choice, and ideally you should do it on a RT-qPCR. Always recommended. But in resource constrained settings, if the patients ask you, yes, can you do this? Then if somebody holds a gun to your head and asks that, can this be done? Yes. Is it the method of choice? No. So coming on to the different kind of PCR which are available. So as previously told, this is the End-point PCR. End-point PCR, basically you lock up everything into a tube, you put it into a PCR thermal cycler, you use this ethidium bromide gel electrophoresis method to document the presence of the fusion transcript. So this is, for example, patient sample. This is the negative control, positive control for E13A2, E14A2 and ladder. So this is how the entire experiment is set up. Advantage of this particular test is it is a very cost effective. It hardly costs 500 to 600 rupees. The gel electrophoresis, this ethidium bromide gel electrophoresis, it is very cheap and very easy to use, user friendly also. Then comes RT-qPCR. I've just discussed about its utility in CML. So it measures fluorescence signal of bulk reaction mix. It has high speed and high throughput. It is slightly costly than End-point PCR, but less costly when compared to digital PCR. But there is a drawback that it cannot be multiplexed. Coming on to the digital PCR. So digital PCR is a recent technique where it helps in the rare event detection. So it is based out of the Poisson statistics, where it identifies the presence of a positive droplet among, say, 10,000 or lakh negative droplets. So that is how it depends on the fragmentation of the reaction volume. It is very precise. Advantage of the digital PCR is it does not require standard. Just like real-time PCR, it required standard. This does not require a standard. But the drawback is it has a high cost, right? So single sample of digital PCR you can process.